Hey everyone, and welcome to a deep dive,
Hmm.
into the world of mental health.
Always exciting.
Yeah. Today we're going like way beyond the surface, right? We're diving deep into dementia care and
Absolutely.
specifically classification systems.
Yeah.
You've shared some really thought-provoking articles and research with us, and I'm excited to unpack it all, with your help. Get ready to explore the pros and cons of classification systems,
Yeah.
their impact on diagnoses, and how they actually, play out in real-world scenarios,
Yeah.
especially when we're talking about, complex conditions like dementia.
Absolutely.
Let's get started.
Okay.
Okay, so
That was good.
classification systems in mental health,
Yeah.
they're constantly evolving, right?
We are constantly
And
evolving.
understanding their nuances is so crucial,
Yeah.
especially when we're considering the ethical implications for patient care.
Absolutely. I think one of the biggest things to remember is that, these classification systems are tools. And like all tools, they can be used for good or for bad.
That's such a good point.
And so I think it's really important for us as, future mental health professionals to really understand not just like what the diagnoses are,
Right.
but like what are the implications of giving someone a diagnosis?
Yeah,
How does that impact their life? How does that impact their access to resources?
right.
All of those sorts of things.
It's not just about memorizing the ICD-11.
No, not at all.
Right. It's about understanding the why behind the systems and
Exactly.
how they can be used effectively
Yeah.
and ethically.
For sure. And I think, one of the things that's really important to remember too is that these systems are created by people
Right.
and people are fallible.
They are.
And so there's always going to be, room for improvement
Of
and
course.
there's always going to be limitations to these systems.
Yeah, and speaking of limitations, some of the articles you shared,
Right.
they raise concerns about, the limitations of these systems. Like
Yeah,
there's this idea that they can be kind of reductionistic, you know,
for sure.
leading to potentially, labeling and stigma.
Absolutely.
What are your thoughts on these critiques?
Yeah, I think that's a really valid concern. And I think a lot of the critics of these systems, they worry that we are reducing very complex human experiences
Mm-hmm.
down to these very simple categories.
Right.
And I think that there is a danger of that,
Yeah.
and I think it's really important for us to be mindful of that when we are, using these systems and when we are talking to people about their
It's
diagnoses.
like fitting a square peg into a round hole.
Exactly.
Human experiences are so diverse and fluid,
Yeah,
while, diagnostic categories can feel much more rigid.
much more rigid. And I think that's, one of the challenges of these systems is trying to find that balance between,
Right?
recognizing patterns,
Mm.
but also respecting individual differences.
Yeah, absolutely. And that actually brings us to this concept of
Yeah.
epistemic accuracy.
Yes.
It's about making sure that our classification systems and the methods we use to categorize individuals
Mm-hmm.
are grounded in, the best available evidence
Absolutely.
and understanding of, the phenomena that we are trying to classify.
Yeah, and I think, the term epistemic accuracy, it sounds really complicated and jargony,
It does.
but really what it boils down to is, are we measuring what we think we're measuring?
I like that.
Are these categories actually reflecting, the reality of people's experiences?
Okay, so it's about constantly, questioning
Yeah,
and refining our systems to make them more accurate
for sure.
and more relevant.
Absolutely. And I think that's one of the things that's really exciting about this field is that it's always evolving.
It is.
There's always new research coming out. There's
Yeah.
always new ways of thinking about things.
Yeah.
And so I think it's really important for us to stay up to date,
Hmm.
to be critical thinkers,
Yes.
and to always be questioning,
Yeah.
what we're doing and why we're doing it.
Okay, so the challenge is to find that balance,
Yeah.
right, between using these systems as tools
Yes.
for communication,
Mm-hmm.
research,
For sure.
but also recognizing their limitations
Yeah.
and their potential for misuse.
Absolutely. And I think, one of the areas where this is particularly important is in the area of dementia care.
Right.
Because, we often see these behaviors in people with dementia that we label as challenging.
Challenge behaviors, yes.
But, I think it's really important for us to remember that those behaviors are often a form of communication.
Absolutely.
They're a way for the person to tell us that something is wrong,
Mm.
that they have an unmet need.
Yeah, and that actually perfectly segues into, those models you were talking about,
Right.
the Newcastle and Iceberg model.
Yeah, exactly.
They offer valuable frameworks, I think,
I think so too.
for understanding and addressing those needs.
Yeah.
Can you explain a little bit more about how these models work?
Sure. Yeah. So both of these models, they really encourage us to move away from just thinking about behaviors as challenging
Mm-hmm.
and to really see them as signals of distress.
Okay, so instead of trying to suppress those behaviors,
Yeah,
we need to understand what's driving them.
exactly.
Okay, I like that.
Yeah. So the Newcastle model, it takes this biopsychosocial approach.
Okay,
It recognizes, the complex interplay of biological factors, psychological factors, social factors,
right.
and it really guides us to assess and manage these behaviors by identifying and fulfilling those unmet needs.
It's like detective work.
It is like detective work. It's
Mm-hmm.
about really trying to understand, you know, what is going on for this person?
Mm-hmm.
What are they trying to communicate to us? And
Yeah.
how can we best meet their needs?
I love that. And then the iceberg model,
Yes.
such a powerful visual metaphor.
It is. It
Right.
is a powerful visual metaphor.
It reminds us that the observable behaviors are just the tip of the iceberg.
Exactly. And, when we think about an iceberg, we know that the vast majority of the iceberg is actually hidden beneath the surface.
Right.
And so it's the same with these behaviors.
Right.
What we see on the surface
Yeah.
is just a very small part of what's actually going on.
Okay, so what are some of those unseen factors lurking beneath the surface?
Well, there's a whole range of things that could be contributing to a person's distress.
Mm.
It could be things like, physical health problems
Right.
like pain or discomfort. It
Mm.
could be mental health conditions like
Mhm.
anxiety or depression.
Yeah.
It could be, personality traits,
Okay.
past life experiences,
Oh, wow.
medication side effects.
It's a lot to consider.
It is a lot to consider.
So how do we, as future mental health professionals,
Yeah.
help individuals with dementia
Yeah.
manage all of this?
Well, I think that's where, these person-centered models that we've been talking about are so important because they really guide us to assess the individual holistically,
Mm-hmm.
to identify those potential stressors,
Yeah.
and then to develop tailored interventions.
Okay, so we're talking about things like,
Yeah,
adjusting the environment,
absolutely.
providing, meaningful activities,
Yes,
ensuring physical comfort,
for sure.
offering emotional support.
Yeah, and I think, one of the most important things that we can do
Yeah.
is to advocate for non-pharmacological interventions
Okay.
whenever possible.
What does that mean?
So that means, trying to find ways to address the person's needs without using medication.
Right.
Because, medication can have side effects. It can
Yeah.
be expensive.
Yeah.
And it doesn't always address the underlying cause of the problem.
So it's about finding that balance again.
It's about finding that balance
Right.
between
Yeah.
non-pharmacological approaches.
Yeah, and I think, the NMC Code of Conduct.
Yeah. Actually provide some really good ethical guidelines
Uh-huh.
for nurses in supporting individuals
Okay.
experiencing stress and distress.
Okay, what are some of the key principles
Yeah.
from the NMC Code?
So, I think some of the most important principles are, prioritizing the person's well-being,
Okay.
respecting their dignity,
Mm-hmm.
involving them in decisions about their care,
Right.
practicing effectively.
What does practicing effectively mean?
So that means, being knowledgeable about dementia,
Okay.
being skilled in assessment and intervention,
Mm-hmm.
and being committed to ongoing learning.
So it sounds like, the NMC Code really emphasizes this holistic and compassionate approach to care.
It does.
It's about seeing the individual as a whole person,
Yes.
not just a collection of symptoms or behaviors.
Exactly. And I think, that's something that's really important for us to remember
Absolutely.
as we're working with people with dementia.
Right. And I think, it's a really powerful message and one that I think will resonate with all of our listeners
Mm-hmm.
who are, passionate about providing that ethical and effective mental health care.
Absolutely.
But before we move on,
Yeah.
I kind of want to circle back
Sure.
to that concept of physiological and psychological stressors
Okay.
in dementia.
Yeah.
Can you give us some specific examples of each?
Yeah. So, when we're thinking about physiological stressors,
Yeah.
these are things that are happening in the body,
Okay.
that are causing stress. So it could be things like, pain,
Okay.
constipation,
Mm-hmm.
infections,
Right.
dehydration,
Wow.
sleep disturbances,
Okay.
medication side effects.
So even those seemingly minor discomforts
Yeah,
can actually significantly impact a person's well-being.
absolutely.
Yeah.
And, I think sometimes we forget about that.
Hmm.
We think about the big things like,
Mm.
cognitive decline
Right.
and memory loss. But, sometimes it's those little things
Those little things.
that can really make a big difference.
Okay, and then psychological stressors.
So psychological stressors
Mm-hmm.
are things that are happening in the mind
Okay.
that are causing stress.
Right.
So,
Yep.
for people with dementia,
Yeah.
this could be things like, the fear of cognitive decline,
Right.
the grief of losing memories
Right,
and
yeah.
independence,
Mm-hmm.
the potential for disorientation and confusion,
Right.
even hallucinations or delusions in some cases.
That's heartbreaking to think about.
It is heartbreaking. And I
Yeah.
think, it's really important for us
Yeah.
as mental health professionals
Yeah.
to be attuned to those potential stressors and to intervene compassionately and effectively,
Absolutely.
Yeah.
Yeah, I couldn't agree more. I mean, this deep dive is already
Yeah.
like making me rethink my entire approach
Yeah.
to dementia care.
It's a complex field,
It is.
and I think it's one that really requires us to,
To be constantly learning and growing.
Yes,
It-
absolutely.
Wow.
But before we, get too lost in the practicalities,
Sure.
I want to shift gears back
Yeah, okay.
to the broader discussion of classification systems
Yeah.
in mental health.
Yeah.
So are they ultimately helpful or harmful?
That's a great question and one that we'll be diving into in our next segment.
Stay tuned, listeners, because in the next part, we're going to delve deeper into the philosophical and ethical dilemmas of classifying mental health conditions
Oh, sure.
and explore whether these systems ultimately help or harm individuals.
It's going to be good.
It is going to be good.
I'm looking forward to it.
Me too. Welcome back, everyone. Let's continue our, deep dive
Yes.
into this fascinating world of mental health.
Absolutely.
So in the last segment, we explored the challenges, right,
Yeah.
of classifying these mental health conditions
Mm.
and the importance of understanding those, unseen factors
Right.
that contribute to distress,
Absolutely.
especially in dementia care. Yeah, for sure. Now, I want to kind of shift our focus
Okay.
to the heart of the debate.
Yeah.
Are these classification systems ultimately
Right.
helpful or harmful?
That is the million-dollar question, isn't it?
It is.
There are compelling arguments on both sides,
There are. Yeah.
And I think it's important to consider both of those perspectives.
Okay, let's start with,
Yeah.
the proponents of
Okay.
classification systems.
Yeah.
What are their strongest arguments?
Well, I think, one of the biggest arguments in favor of classification is that we need a shared language
Okay.
in mental health.
A shared language. Okay.
Okay.
So it's like having that common ground
Yes.
for communication
Exactly.
among professionals,
Right.
researchers,
Yeah.
even policymakers.
Absolutely.
So a shared language is essential then
But
for effective communication,
Yeah.
collaboration, research.
For sure.
It makes sense that you would need that consistent way
Yeah.
to describe and categorize.
Mental health conditions.
Right.
Especially when conducting research
Yeah.
and developing treatments.
Absolutely, because if everyone's using different terms
Right.
and different definitions,
Yeah.
it's really hard to compare apples to apples.
It is.
It's really hard to know if we're talking about the same thing.
It seems like having a diagnosis
Yeah.
could also be beneficial
Mm-hmm.
for those individuals seeking treatment.
Right.
It could provide a sense of validation
For sure.
and relief,
Yeah.
knowing that their experiences are recognized
Yeah.
and that there are treatments available.
Absolutely. I think that's a really important point.
Yeah.
Because, for a lot of people who are struggling with mental health issues,
Mm-hmm.
they may feel very alone.
Right.
They may feel like nobody understands what they're going through.
Of course.
And so to receive a diagnosis can actually be very validating.
Yes.
It can be like, oh, okay,
Yeah.
there's a name for this.
Right.
I'm not the only one who experiences this.
It's like putting a name to what you're experiencing,
Exactly.
which can be a huge step toward,
Yes,
seeking help
absolutely.
and finding support.
For sure.
And it can help you access resources
Yes.
like support groups,
Ugh.
specialized therapies.
Right.
Okay, so those are some pretty compelling arguments
Yeah.
for the use of classification systems.
They are.
But as we discussed, earlier,
Yeah.
there are also valid concerns
So true.
about, those potential downsides.
Right.
Can you talk a little bit more about that?
Yeah. I mean, I think, one of the biggest concerns is about the potential for reductionism and labeling.
Right.
I think a lot of critics of these systems worry that we're reducing complex human experiences down to these very simple categories.
Right.
And I think that's a valid concern.
Yeah.
We don't want to lose sight of the fact that each person is an individual
Hmm.
with their own unique set of experiences and circumstances.
It's that square peg, round hole dilemma.
It is.
We keep coming back to
Yeah.
finding that balance
Yeah.
between recognizing patterns,
Mm,
but respecting those individual differences.
for sure.
And then we have to be mindful of the stigma
Absolutely.
and the discrimination
Yeah.
that can sometimes come with a diagnosis.
Right. Because a diagnosis can become a label,
It can?
and that label can carry negative connotations,
It can.
and it can lead to prejudice and social isolation.
Okay, so it seems like this debate
Yeah.
ultimately boils down to
Right.
how do we use these classification systems
Mm.
responsibly,
Mm.
ethically,
Right.
maximizing the benefits
Yeah.
while also minimizing the potential harms.
This is a challenge, isn't it?
It is.
And I think, it's a challenge that we all need to be thinking about
Mhm.
as mental health professionals.
Yeah, this has been such an insightful conversation.
Yeah.
I feel like we've explored the nuances
for sure.
of classification systems,
Hmm.
delved into, the complexities of dementia care, and grappled with those ethical dilemmas
Yeah.
of, diagnosis
Yeah.
and treatment.
For sure.
What are some key takeaways
Okay.
that you'd like our listeners to remember
Yeah.
as they continue their journey
Mhm.
into, the world of mental health?
I would say the most important takeaway is to approach every individual with empathy,
Okay.
curiosity,
Mm-hmm.
and a genuine desire to understand their unique circumstances.
Love that.
Use classification systems as tools
Okay.
to guide your assessment and treatment planning,
Mm-hmm.
but never let those systems define the individuals you serve.
That's excellent advice.
Thank you.
Remember, folks, every person has a story.
They do.
And it's our job as mental health professionals
Yeah.
to listen carefully,
Mm.
to learn from their experiences,
Absolutely.
and to provide the most compassionate
Yeah,
and effective care possible.
for sure.
Stay tuned for that final part of our deep dive, where we'll explore some alternative perspectives on classification and discuss emerging trends in mental health care. Welcome back to our deep dive, into mental health.
Yes. Always happy to be back.
Me too.
Yeah.
In this final segment, I want to explore some alternative perspectives on classification
Okay, sounds good.
and discuss some emerging trends that are shaping the field.
Yeah, for sure.
Throughout this deep dive, I've been wrestling with this idea that classification systems can feel like trying to define, something as fluid and complex as human experience
Yeah.
with just like a set of rigid categories.
I completely understand that. And I think a lot of mental health professionals grapple with that tension as well.
Right. It's like, one of those optical illusions
Mhm.
where you can see two different images depending on how you look at it.
That's a great analogy.
So on one hand, we need some sort of framework,
Right.
to help us understand and categorize mental health conditions.
Yeah,
But on the other hand, we don't want to lose sight of the individual's unique experience.
absolutely. I think that's the real challenge, is finding that balance.
Yeah. So are there any alternative approaches
Hmm.
that try to address this tension?
Yeah, absolutely. One approach that's gaining a lot of traction is the dimensional model of classification.
Okay. And how does that differ
Yeah.
from, that categorical model that the ICD-11 uses?
So instead of placing individuals into these distinct categories,
Okay.
the dimensional model views mental health as more of a spectrum.
Okay. So rather than saying someone either has depression or doesn't,
Right.
you would look at the severity of their symptoms on a scale.
Exactly. And that's a really helpful way of thinking about it, because it acknowledges that mental health isn't black and white.
Mhm.
It's not either you have it or you don't.
Right.
There are shades of gray.
Yeah. It's, thinking about height.
Yeah.
We don't categorize people as either tall or short.
Right.
We recognize that height exists on a continuum.
Absolutely. And I think the dimensional model allows for a much more nuanced and personalized understanding of mental health.
Okay, the research that you shared mentioned the research domain criteria,
Mm-hmm.
or RDOC. Is
Yes.
that an example of the dimensional approach?
Yes. RDOC is a framework developed by the National Institute of Mental Health, and it aims to move beyond these symptom-based categories
Okay.
and really focus on the underlying neurobiological and behavioral processes.
So it sounds like a pretty radical shift
It is a radical shift,
in thinking about mental health.
and it's still in its early stages,
Mm.
but it has the potential, I think, to revolutionize
Okay.
how we understand,
Yeah.
diagnose, and treat mental health conditions.
It's fascinating to think about how our understanding of the brain and behavior
Yeah.
can lead to more precise
Mm-hmm.
and effective treatments.
Absolutely. And I think that's what's so exciting about this field is that we are constantly learning new things.
We are.
And that's leading to new and better ways of helping people.
Yeah. Another area where I think we're seeing a lot of innovation
Yeah,
is in the development of technology-based interventions.
absolutely.
So things like,
Hmm.
mental health apps, online therapy platforms,
For sure.
all that good stuff.
All of that. And I think those technologies have incredible potential
Yeah.
to increase access to care,
Yeah.
especially for people who live in rural or underserved areas who might not have access to traditional mental health
Right,
services.
and it offers, a level of anonymity that some people may find, more comfortable
Absolutely.
than traditional therapy settings.
And I think that's really important because, there's still a lot of stigma around mental health.
There is.
And so anything that we can do to reduce that stigma
Mhm.
and make it easier for people to access care
Yes.
is a good thing.
It's really exciting to see how, technology is being harnessed to improve those mental health outcomes.
It is, and I think it's only going to continue to grow.
But, it's also crucial to approach these technologies
Yes,
with a critical eye.
right.
Yeah.
Absolutely. I think that's really important because, not all technologies are created equal.
Right.
And we need to make sure that the technologies that we're using are evidence-based,
Okay.
that they're safe,
Yeah.
that they're effective,
Mhm.
and that they're protecting user privacy.
Those are all very important considerations.
They are.
The field of mental health is
Yeah.
constantly evolving.
It is.
And,
Yeah.
as future mental health professionals,
Mhm.
you have this incredible opportunity
We do.
to shape the future of this field.
Absolutely.
That's both exciting and a little daunting, I think.
I think so too, but I think it's important to remember that you don't have to have all the answers.
It's good to hear.
The most important thing is to stay curious,
Yeah.
to be open to new ideas,
Mhm.
and to always prioritize the well-being of the individuals you serve.
I love that message, and that's a great message to end on.
Thank you.
Thank you so much for sharing your expertise with us today.
It's been my pleasure.
And to all of our listeners out there, thank you for joining us on this deep dive into the world of mental health. We hope you've gained some valuable insights from this, and that you'll continue to explore, this fascinating and ever-evolving field. Until next time, keep learning, keep questioning, and keep advocating for a more compassionate and just world.